Focus. Ideate. Innovate. Enable.
Welcome to our special series, Live Well with Diabetes. I'm Devina Lason. Now, through this series, it is our endeavor to spread awareness about diabetes, establish facts, and dispel myths. So far, we've met with medical experts from across the country to discuss the impact of diabetes on the heart, eyes, nerves, kidneys, and more, as well as gestational diabetes and diabetes seen in children. Today we're coming to you from Kolkata to discuss challenges in the management of diabetes and the importance of self-monitoring. Joining me on the panel are Dr. Shubhankar Chaudhary. He's the Professor and Head, Department of Endocrinology, IPGMER, Kolkata. Dr. Avdesh Singh. He's the Consultant Endocrinologist, GD Hospital and Diabetes Institute, Kolkata. And Dr. Sujay Ghosh, Associate Professor, Department of Endocrinology, IPGMER, Kolkata. Doctors, welcome. It's a pleasure to have you all here today. Thank you for joining us. Dr. Chaudhary, I'd like to start with you. Let's start from the top. What would you say are some of the challenges that patients face in the overall management of diabetes?
First of all, one has to realize that it's by and large a lifelong condition. So you need to live with it. And it's something that is quite often progressive, meaning that thereby that you cannot just have a one-time prescription and get the rest of your life controlled with that prescription. So you need to go for tests, you need to go for consultations, and of course, most importantly, if you call that a challenge, I would think that's an opportunity to have some amount of self-discipline. Right. That's the key word in management of diabetes.
Dr. Singh, but talking about the management of diabetes, one of the factors that does impact this is hypoglycemia. So can you tell us a little bit about hypoglycemia and how does this affect diabetes management?
When we look to the conventional plan of diabetes treatment with the older agents to treat diabetes, these drugs does have limitations of making patients having too much of low blood glucose. So that's called hypoglycemia. Hypoglycemia is the reduction in blood glucose to the extent that it produces symptoms. Sometimes it may not be too low, or sometimes it may be too low but patients are not developing symptoms. So it may be symptomatic, it may be asymptomatic.
Right.
I mean, somebody may have a low blood sugar but still by monitoring the glucose or by testing through the glucometer, but the patients might not have symptoms of hypoglycemia. These are the limitations, one of the limitations of the conventional agent, that it causes low blood sugar. It has got a potential to increase body weight that we can also discuss about. But yes, the older conventional methods of treating diabetes with the older drugs has got one limitation, that was surreptitious hypoglycemia, means suddenly somebody develops low blood glucose.
Dr. Ghosh, in the cases when it's not asymptomatic, can you tell us what are some of the signs and symptoms of hypoglycemia and what are some of the very sort of key and pertinent complications as well?
If an individual has symptoms, the symptoms are often very varied. Every individual will have certain symptoms more commonly in that individual, which is an important thing. Therefore, whatever symptoms I talk about, not every patient will have all of them.
Right,
and some of them might have just a tingling around the mouth, a dizziness, a lightheadedness, and gradually it could be more symptomatic, like it might have palpitation, sweating, feeling very hungry, feeling dizzy. Some might even have loss of consciousness. And it would depend on the degree of hypoglycemia and how long the individual has had hypoglycemia. It might lead to a situation where the person has lost consciousness. There might be seizures as well. But it would all depend on how quickly it has happened and how long it has happened. So those would be the kind of symptoms. And in terms of complications, we can think of certain immediate complications and certain long-term complications. Even having a seizure and falling down somewhere might lead to tremendous complications. And you might have temporary or even permanent neurological damage. You might have, with recurrent hypoglycemia, subtle changes to the brain, particularly in children and even in adults. And it's also suggested that hypoglycemia might be a trigger for a cardiovascular event.
Wow.
So that might be leading to maybe a cardiac event as well.
In terms of the symptoms, I mean, Dr. Sujagos correctly said that it could be very varied, and sometimes someone can just present with an abnormal behavior. Otherwise, docile person may suddenly become very aggressive.
Sure. You know, doctor, you mentioned that hypoglycemia is also seen in children after all. Is there a sort of prevalence of hypoglycemia in children versus adults? What would you say is the ratio?
It's more asymptomatic in kids. Right. And the other thing is, you know, there are three things which ultimately decide what your blood glucose is going to be. What's your level of physical activity or energy expenditure, the amount of food that you're consuming, and the drug that you're taking. It has to be a balance between these three. And kids, you know, often either exercise too much, play around, or they don't have enough food to consume. So those would be reasons perhaps why kids might be at a greater risk at times of having hypoglycemia. Symptoms might be much more subtle, and they might not be that careful in taking corrective measures as quickly as an adult probably would.
Right, absolutely. Dr. Chaudhary, is it possible to prevent hypoglycemia?
Yes and no. First of all, taking medications at the right time, taking your meals at the right time, exercising, and then of course looking at medications. There are certain medications which Dr. Avadhir Singh already mentioned, which are more prone to cause hypoglycemia. Their insulins quite often tend to cause hypoglycemia. Among the tablets to reduce blood glucose, there are certain ones which can cause hypoglycemia. There are others which may not. Even amongst insulins, we could choose between ones which are more likely to develop to cause hypoglycemia and others which are less. So we as doctors can definitely help select the right drugs. Sometimes that again becomes a challenge because the ones that tend to cause less hypoglycemia are more costly.
Right.
So in those instances, we have to educate them very properly when we are using a drug that could cause hypoglycemia.
Lifestyle factors, etc.
Lifestyle, and also what are the likely symptoms so that you can detect at the earliest moment and then maybe check yourself and then take the corrective measures.
Dr. Singh, let's talk about the association of weight management with diabetes management. How are the two correlated, and does weight management also pose additional complications to diabetes management?
Well, so obesity means increase in body weight is one of the important risk factors for developing diabetes. So type 2 diabetes is often associated with obesity, right? You hardly find patients with type 2 diabetes who are underweight. So majority of the patients of type 2 diabetes are predominantly obese. Now, one of the limitations of existing diabetes treatment is that these therapy leads to increase in body weight. For example, if you're using the insulin, whatever type of insulin you are using, it tends to increase body weight. If you look into the most commonly used drug like sulfonylurea, which we often use in clinical practice, these drugs also has got a tendency to increase body weight. So these overweight and obesity is one of the important limitations of not only the diabetes but also associated with the treatment of diabetes. But we have got now very modern drugs which are not associated with minimal or nil hypoglycemia, but also has got a tendency to reduce body weight.
Right.
So we have got some modern agents which not only controls the diabetes but also tends to lose body weight and doesn't cause hypoglycemia. That's the beauty of modern management of type 2 diabetes.
Yeah.
But Dr. Singh, in the real world, how easy do you find to get your patient to lose weight in the long run?
Yeah,
we all talk about lifestyle.
True. That's a very important question. That's the truth. That although we often discuss to our patient that yes, you have to do a regular exercise 30 minutes every day, at least 5 days in a week, but then patient starts with with one hope that I'm going to do it, but gradually they somewhere lose sticking to the plan. So that's the biggest problem, as Professor Chaudhary said.
So motivation is very important.
Very important.
You have to be.
Absolutely. Dr. Ghosh, talking about the other factors that impact diabetes management, can you tell us a little bit about glycemic variability? What is it exactly and how does it impact your diabetes management?
Right. Many a times patients will come to the clinic and tell us, my sugars are just going up and down.
Right.
At times I'm having a hypoglycemia, and like Dr. Singh was talking about, the patient might then overcompensate by eating more than what is normally supposed to be taken, and the blood sugar might go up. So it's more of a roller coaster journey for the patient.
Right.
Sometimes it's high, sometimes it's low. Maybe it's high and low between days, or it might be high and low in the same day itself.
On the same day. Yeah.
And a lot of this can happen because a lot of factors. Like I said, we need to have a balance between the energy expenditure, energy consumed, and the drug.
Yes.
The underlying organs have to be working very well so that there is less variability. And it again depends on the stage of diabetes that you have.
Sure.
The less insulin that you have, that is what we call insulinopenia, you're more likely to have this kind of variability.
Okay.
Because the body can't cope with these changes in the sugar levels in terms of what is consumed and what is expended. And this kind of variability can lead to a lot of problem, because a lot of people might then get scared that I'm not going to control my blood sugars very tightly because I might develop a hypoglycemia, and he might let his sugars run relatively high. That's one side. The other side, people who might be getting very paranoid about relatively higher sugars, trying to overdo things and having recurrent hypoglycemias. And if we look at, what are the predictors of long-term outcome of diabetes, one of the outcome predictors is glycemic variability in terms of complication rates.
Dr. Chaudhary, is it true to say then that self-monitoring will truly help you manage the variability factor, maybe even help you bring it down?
Yes, but we need to remember that self-monitoring is only a tool, and the tool will be effective to the extent that you use it properly. So self-monitoring gives you blood glucose values at different times of the day. Now what you need to do is to either empower, educate your patient what to do with those values in order to reduce the variability, or they have to come back to the physician and he or she has to tweak the doses, the treatment in order to reduce the variability. So that's a stepping stone, but beyond self-monitoring there are other, the conventional self-monitoring whereby one has to prick one's fingertip typically several times in a day, but there are other methods where you can get an idea of continuous glucose levels within our body by special devices. Those are also possible, and that can throw more light on the glycemic variability that's occurring.
Okay. How often should a diabetic patient check his glucose level? How often should the monitoring process happen?
Well, that depends upon, what kind of diabetes you are suffering from. For example, type 1 diabetics are on basal bolus insulin therapy, means the integral part of treatment is only insulin type 1 diabetes. In type 2 diabetes, your patients might be getting tablets or might be on insulin as well. So the self-monitoring is important for everybody, for all diabetics. But then those who are on an intensive treatment plan, especially those who are on an insulin, are supposed to self-monitor the blood glucose frequently, because we know that insulin does have a potential to cause hypoglycemia at a time. For the patients, what is the practical importance is that you must measure blood glucose frequently at your home, especially if you are on insulin. Ideally you should measure, let's say, 7 times a day, but at least those who are on insulin should measure 2 to 3 times blood glucose, for two things. Number one, to detect hypoglycemia. Second, also for adjusting the insulin dose.
And is this the same for adults and children both?
For the children, especially when you are considering children, means we are considering as a type 1 diabetic children, there probably self-monitoring role is very important, because children has to perform a various activity, going to school and then playing. Here self-monitoring is even more important than the adults, because they also tends to follow the regime not very strictly to the extent what the adults should follow. So there should be a little bit strictness in terms of self-monitoring in the children compared to adults.
And while we do know what's ideal, maybe several times in a day for those on insulin, quite often we have to compromise in order to accommodate patients' preferences, comfort zone, and so on. So when we are doing less than maybe 7 times, as Dr. Singh suggested, we have to use it in a structured fashion. For example, you do before and after breakfast today, tomorrow you do before and after lunch, day after you do before and after dinner. Then you get the entire information that we would have got, but maybe we use less number of breaks.
Sure. Dr. Ghosh, can you tell us about the role that technology plays in self-monitoring? Where are we at in terms of technological advancements that help diabetes patients to monitor their glucose levels?
Right. In terms of technology, it's wonderful to have technology and wonderful to detect problems. But the problem that we as doctors see is people tend to write down their glucose readings beautifully, but they don't act upon it.
Sure.
Unless and until you act upon the information that you've collected, there is no use of having technology.
Absolutely.
That's number one. You can use glucometers that we use in our clinics or at home to monitor glucose at different times of the day. You have implantable devices which can be put in for, say, 3 days or even 14 days, which will give you continuous tracings of what you already have. A lot of these glucometers, you can then connect it to your computer or your mobile phone. You have several apps that the phones now have, which will tell you, this has been what your glucose pattern has been, and would even might tell you that, these are the kinds of adjustments that you're probably going to do well with in terms of your medication, in terms of your diet. These apps even tell you, what the carbohydrate content of a particular foodstuff is, so that you know exactly how much of more insulin or bolus insulin that you would want to take in. Not all of them are actually validated apps, so you've got to know which ones have been tried out in clinical studies and trials before you try them. But a lot is out there. But even with the basic stuff that we have, because a lot of people might think, I do not have access to this technology or that technology, how am I going to manage my diabetes? Because India is a country where we predominantly have people who cannot afford everything.
Right.
So there, even with the simple glucometer or simple glucose monitoring, you can still lead a very good life and achieve very good control of diabetes.
But you brought up a very interesting point that not all of this technology is validated. What would you say, doctors? Would you recommend to your patients to use these apps, use the various devices, or would you rather recommend a more traditional form of monitoring of the levels?
First of all, I think the statement would apply to all 3 of us on the panel, is that by and large the established glucose reading meters are quite reliable. Now, whether or not you use an app, I think we have to leave it to personal choices as well and preferences.
With the modern calibrations of a newer glucometer, we are almost similar to what you do it in a laboratory. So apps might be useful in terms of gathering data and giving you a hint to how to go further ahead. But then this is not a validated one. None of the international recommendation or from the national recommendation have still approved any apps as of now, because it has not been validated as of now.
I would rather have more diabetes educators in my country.
Right.
Because if they were able to educate the patients of how to interpret, how to help the patient to adjust doses and monitor, that would go a long, long way. I think all developed countries have that. We are in the process. India is growing. We have educators in some centers, but we need more diabetes educators. Ultimately, the more educated the patient is about his own disease problem, the better is the outcome.
Absolutely, absolutely. Well, doctors, that's some really good advice. That's been a very informative conversation. Thank you so much. But before we wrap up, one tip or a few tips from each of you to living well with diabetes. Dr. Chaudhary.
Well, accept diabetes, don't try to hide it, and control it before the disease controls or consumes you. And that's absolutely possible with current treatment.
I would recommend 3 things to remember for all of my patients. Simple ABC means make your A1C correspond to A1C. Make your A1C means blood glucose to normal, as much as close to the target, which is the current recommendation of 7% of HbA1c. B is for your blood pressure. Often patients is not looking into the blood pressure part. Everybody is sticking into blood glucose. BP control is equally or rather more important than blood glucose. So control your blood pressure to the target. C is your cholesterol. Lipids is very important part of diabetes management. People often forget and do not give importance to the lipid which in fact out of these three is much more important.
Sure.
So lipid control, so control your cholesterol as well to the target. So A for HbA1c, B for blood pressure, C for cholesterol for every diabetic patient.
Remember that diabetes is not a disease of glucose. We all tend to get very, very glucocentric. We have to have a holistic approach. In addition to what Dr. Singh has said, weight and tobacco in any form is two other things that I would like to highlight on. And try to know about the disease more so that you can take control of it.
Educate yourself.
Education is the key.
Thank you so much for joining us. It's been a pleasure. Thank you, all of you.
Thank you very much.
Thank you so much.
Well, that's all we have for you on this episode, but stay tuned to the channel as we continue to travel across the country to meet with medical experts who will answer all the questions you may have on staying healthy with diabetes. Until then, from the entire team, many thanks for watching.
Focus, ideate, innovate, enable.